Hi, good afternoon. My name is Anthony and I'm from the Respiratory Care Department. Can I ask for your complete name and date of birth? Okay, thank you. So before I will proceed, I just have to check for your vital signs, listen for your breath sounds, and also for your heart rate, check your level of saturation. Can you lean a little forward for me and deep breathe for me? Okay, thank you. Is anything fun? Just have to check your level of saturation and also check for your heart rate. At the same time, I also have to double check your ID bank for confirmatory purposes. Okay, so thank you. I think I'm done taking up your vital signs. So, the reason why I'm here today is because the doctor ordered you a breathing treatment. So there will be three different breathing treatments that I'm going to administer. And those medications belong to three different types, such as the anticholinergic, which is indicated for helping you decrease your sputum production and open up your airways. And also adrenergic, which is also indicated for relief from any airflow obstruction and to allow you to breathe better, and corticosteroids, which is a maintenance medication for anti-inflammation. So the first medication that I'm going to give is through a small volume nebulizer. It is medication called Brovana. So I already here prepared it for you. It is ordered by the way for you for twice a day, and it would last for 12 hours. So first is you have to put this one inside your mouth with your lips sealed. When you put this inside your mouth, your tongue should also be below. Please do not obstruct the mouthpiece. So once I'm going to put inside your mouth, all you have to do is you just have to do normal breath like this, with occasional deep breaths. Okay, so are we ready to perform it now? Okay, so I'm going to use a compressor-based nebulizer. Put inside your mouth with your lips sealed and your tongue should be below. Okay, do normal breathing. Very good. With occasional deep breaths. Okay, so I think I'm done taking up this medication. And then before anything else, can you take a deep breath at the same time cough for me, please? Okay, thank you so much. So I'll just have to let you rest for a few seconds until a minute to allow the drug to take effect inside your lungs. So I think I'm done letting you rest. So the next medication that I'm going to administer it to you is through an inhaler. So this inhaler is a dry powder inhaler. So the medication that I'm going to give is Spiriva. The medication, by the way, is being ordered for you for one inhalation once daily, and it would last for 24 hours. So here is the dry powder inhaler. So first is you have to exhale all your air out away from the device to prevent from any clumping. And next is you have to twist the device to check if it is okay to use, or check from any foreign objects. After that, put this one inside your mouth, sealed with your lips, and then once it's inside your mouth, you do a deep inhalation and hold your breath after that. Once you do a deep breath, hold your breath for about 10 seconds or as long as you can. After you hold your breath, remove the device and exhale normally. Okay, so exhale all your air out. Very good. So I'm doing this for you. Help you guide. Okay, put inside your mouth. Okay, I'm going to count 1, 2, 3, and inhale deep. Hold your breath. Hold your breath. Hold your breath, and remove the device. Exhale normally. Very good. So, because we're taking up a dry powder inhaler, the side effects of this one is a dry mouth. So I'll just have to let you rinse from any side effects. Rinse it with distilled water. So all you have to do is rinse it. Please do not swallow, and then expel all those water out. This would help prevent from occurring any dry mouth. Okay, thank you. So can you do again a deep breathing at the same time cough for me? Okay, thank you. So I'll just have to let you rest for about a minute or a few seconds while preparing for the last dose. So I think I'm done letting you rest. So the last medication that I'm going to administer is an inhaler also, but it has a different type, which is a metered-dose inhaler. This medication that I'm going to administer to you is QVAR. So this one, by the way, is different from the previous inhaler because this inhaler is a liquid form of solution. So the medication, by the way, was being ordered for you for 1 puff twice daily. So it is a medication which has being done from corticosteroids. So first is you have to exhale all your air out away from your lungs and also away from the device. After that, position your index finger from the top to, this will be the guide to help actuate or press the device, and your thumb should be below. And then shake the device. After shaking the device, actuate at least once or press the canister. That. And then once you're ready, put inside your mouth with your lips sealed, and also your tongue should be below from the mouthpiece. And another thing to note, by the way, is that whenever you open the cap, try to observe if there are any foreign objects. Okay? So exhale all your air out. Shake the device. I'm going to do it for you. Actuate it once. Put inside your mouth. I'm going to count 1, 2, 3. 1, 2, 3, and inhale. Hold your breath. Hold your breath. Hold your breath and move the device and exhale normally. So because you're taking up a corticosteroid, its side effects could lead you to change in voice quality and oral thrush. So this one, I also have a glass of water. Please rinse your mouth. Okay, rinse it so that it would help prevent from having those kind of side effects. Okay, expectorate all those water out. Thank you. So can you deep breathe again and cough for me? Thank you so much. So I just have to reassess again for your vital signs. Listen for your breath sounds. Thank you. Check again for your heart rate and level of saturation. Okay, so I think I'm done taking up your vital signs. So another important that I will just educate you, by the way, is that when you clean the device, especially the nebulizer kit, is you have to remove or take it off, each one of them. And then the tubing, by the way, as you have seen earlier, the transparent tubing, this you just have to set aside. Those items that you each remove is you have to rinse it with sterile water. Please don't rinse it with tap water because it might lead to contamination. So once you're done, please put those items on the side, allow it to air dry in a clean paper towel, and then after that, you assemble it and put it in a clean container. And then another thing is for the metered-dose inhaler, as you have noticed earlier, that there was a dose counter, so you can see it would help you know if how many doses remaining until you sense that the inhaler will be empty. And then you should position it upright and also double check again for any foreign objects from the cap. And also for the dry powder inhaler, together with the metered-dose inhaler, it should be stored in a room temperature. So if symptoms would persist more than once, please don't hesitate to inform us and your physician so that we can alter or even change the dosage and its frequency. Okay? So is there anything else I can do for you with? Any further questions? Okay? So thank you so much for your cooperation and have a good day.